Love is one of the 7 grandfather teachings. In our language, we call it Zagidwin. What that means is that a light emulates from your heart to another person. And I feel that our energy needs to be that when we're working with other people or just even interacting with other people. And this is one of the teachings that we would like the healthcare providers to understand and recognize. This is how we see love as an Indigenous person. My name is Neva Isaac Sands. My Anishinaabe name is Imanda Kwe, Kawananol, Nigon Tonkion Adishnakas. My Ingan Jakanto Dam Kajanan Dunjaba. I work at the Chatham-Kent Community Health Centers, and I am the social worker here. I service our Indigenous population, specifically to provide culturally appropriate services and somebody too that they can relate to. The Indigenous Healthcare Planning Committee is made up of different health-related experts, leaders of all different organizations within Southwestern Ontario.
The committee worked with elders and Indigenous leaders to come up with a culture-based integration model, also called the Cultural Framework. And this framework is a commitment to building meaningful relationships that are mutually beneficial between the healthcare system and Indigenous communities. It promotes holistic health from that Indigenous worldview, and ultimately that benefits everyone in the community.
Building a trusting relationship with our clientele, our families, is really important in the beginning. And I think that goes way back to our ancestors. When you greeted somebody, you greeted them wholeheartedly with everything you are, mentally, physically, emotionally, spiritually. So it's a big check-in, and that is, I think, the beginning parts of building that trusting relationship.
The healthcare system is structured. It's very structured. Western medicine has an important place, but it's important that we understand in the mainstream that traditional healing is very, very important, and we all benefit.
The 7 grandfather teachings came from many different places, and one of the ways that I know is through our language that these were taught. And they were taught to a young being. He was brought into the grandfather lodge, and there were 7 grandfathers. What he was instructed to do was to come and be brought down to Mother Earth, Skogminkwe. So he was here to understand and learn all different things. And each of those grandfathers were instructional in helping him understand each one of them. For example, respect, love, truth, honesty, humility, wisdom, and bravery. All of those teachings together were put into this person's life, this being, and so that they could carry on these teachings and bring them for future generations. All of those 7 grandfather teachings together bring a well-balanced person, brings harmony to their life and to the world and their environment, and have a deeper respect for creation.
We had created as almost like a pilot the care plan to be used by I believe it was the complex care coordinators through home and community care. And the idea is that they were going to be dealing with patients who had a multitude of comorbid conditions, but also coupled with perhaps homelessness or housing challenges, mental health issues. When we have better encounters, we start to be able to create a system where people are comfortable and they can get the care that they need when they need it. This is about us working together in commonality, recognizing the distinction between us, but knowing that those aren't enough. Those aren't the principles that need to keep us separate. That we need to really collectively come together to shape the way we see and need to interact and modify our systems for the next 7 generations.
Buju Wabzi Dijnakas, Baketron Dunjaba, Makwadodam. My name's Wabzi and I'm a paramedic. I've been a medic for about 3 years now. When I give care, I like to take a step back, look at the whole picture and realize that there are more needs than just physical and what is happening at the moment. There was this time a couple years ago, I was on a call bringing a palliative patient from Thunder Bay to their home community in northwestern Ontario. When we landed in her community, I saw a big group of people on the tarmac. Once we opened the doors, I saw that it was, I think, every single person in her community. It made me feel overwhelmed. It was so nice to see all the young ones, all the elders. That moment was a great example of the special way that Indigenous people view their healthcare and the importance of community and family.
Quinganawaloma, ni de sinji mako kenzique, unamilanapi o queo, niha tukudulungamao nunjai ilamp e lakawit. My English name is Audrey Logan. I am from the Turtle Clan, and I come from the community of Ilanape Lakawit, and I am a Lenape grandmother. I work at the Windsor Regional Hospital, and I am the Indigenous navigator. I describe my role as somewhere between a nurse and a social worker, because a nurse is regulated by the body that is governing her, and social workers are governed by a body in a similar manner. The support that Indigenous people really need is a cross and a balance between both of those worlds. When you have a navigator in a role at a hospital, you need somebody that is connected to the earth, that's connected to the people, that knows the ceremonies, that knows all of those things, and has a heart for the people. If I had a magic wand, what I would do is I would say the hospitals need to look at the truth and reconciliation calls to action, put them in place, and the hospital themselves is not solely responsible for implementing all of those. It's going to take a team effort. It's going to have to take all of the departments, not just in the hospital, but all the government agencies to work together to make things to become a reality.
My spirit name is Morning Sun Child. My English name, the name that I'm called regularly, is Kelsey. I think that this care model is really important, especially in my role, because it helps us to go back to the holistic healthcare approach, and it keeps the patient centered. As an Indigenous person, there's a lot of historical trauma and things that have happened that mainstream society, I feel like, isn't very well aware of. And so coming from an Indigenous community and being Indigenous, I feel like I can connect with people in that way and to help them navigate through the healthcare system in a way that respects where they're coming from.
So my hope for this guide is that healthcare professionals receive an in-depth training, an understanding of the teachings that are in it, an understanding on how to utilize it in their practice comfortably, so that it's a part of their practice. It's a part of how they offer things.
I would like to see 2 or 3 Indigenous people on the board of directors. We need to have 2 or 3 people that could actually gather some momentum and swing things in a way that would change the face of healthcare.
The healthcare system is changing. There's a First Nation health policy that's coming that's going to set out that work for the Ontario health teams, and it shows what is our treaty obligation, like what is our duty to consult. So I'm really looking forward to the future of this work.
I see it being used everywhere. I don't see any one part of our healthcare system that wouldn't benefit from understanding how to build a good care plan that responds to the physical, emotional, mental, and spiritual needs of our people. And so for me, the way I see the care plan is that it's just a growth and evolution of supports that change as the patient heals or modifies the condition itself. And so when we pull all this together, it's very much with that notion of continuing to support each other. It is supporting these changes in the long-term healthcare plans and the outcomes of our people in ways that does honor and value those original agreements of peace, friendship, and respect.